Hello, my name is Kathy Coyner. I'm an orthopedic surgeon at UConn Health, and I specialize in sports medicine, so I have the opportunity to take care of patients that have injuries to their musculoskeletal system, in their shoulder, their hip, and their knee. So I take care of a lot of athletes as well as weekend warriors. I work in an academic setting where I get to teach medical students and residents as well as orthopedic sports medicine fellows. A little bit about me. I actually grew up in a very small town in southeastern Ohio. I grew up with about 7,000 people in my town. I went to a public high school. I only had about 100 kids in my graduating class. Science was always very sort of one of my interests. As my father was a chemist, I was exposed sort of at an early age of science, but then my mainstay when I was in elementary school and everything was sports. I love basketball. Particularly, I went on to play college basketball at the University of Massachusetts, and through this I learned a lot about injuries, and it really piqued my interest in orthopedics, which is taking care of the athletes. And even in college, after I received a scholarship to UMass, I worked with our orthopedic surgeon there. I would actually get to operate and watch my teammates have surgery, so that really piqued my interest from an early age with medicine. To be a doctor, you have to go to medical school. So after my 4 years of undergrad at UMass, I went to Northeast Ohio University College of Medicine, which is the medical school, and that's 4 years there, and confirmed my desires to go into orthopedics. And then after medical school, you go to residency, which orthopedic surgery residency is 5 years long, and that I did at William Beaumont in Detroit, Michigan. After residency, you have an optional year of doing further training, and that's when I did my sports medicine fellowship. There I went to Duke University. I took care of the athletics at Duke as well as saw patients and even honed my skills from an operative experience. I then, after Duke, my first job was at UT Southwestern in Dallas, Texas, where I spent the first 5.5 years practicing medicine, again, being an academician, teaching residents and medical students, and then joined UConn Health in 2016. Keeping up with times in medicine is really challenging, but I think that's one of the things that I like most about medicine is it's always evolving. There's always new technologies and new things to incorporate into your practice. So for me, teaching residents and medical students, we're always having journal clubs and hearing about the latest and greatest things. Also, I attend meetings all over the country. Sometimes I speak at those meetings and try to educate others, and then other times I attend to learn more about my field of sports medicine. The most fun part of my job is a few different aspects. I love the patients I take care of. You know, getting a patient that comes into your office, say with a torn ACL, which is a ligament in their knee, they're unable to play sports, see them through that entire process, be able to operate on them, rehab them, and when that high school kid gets back to the field and they're so happy, you know, that really brings me a lot of joy. And the same is true with a grandmother who has a rotator cuff issue. You know, they're unable to pick up their grandkids because their shoulder hurts them, and being able to help them through that process. And the other great thing about, you know, orthopedics is not everything is surgery. A lot of times we get to make people better without surgery. So my patients are one aspect. The second aspect is sort of all the people I get to work with, the people in my clinics, the people in the OR that we have such good relationships with, and it really is a team environment to sort of make patients better. And lastly are all the future generation like yourselves of, you know, potential doctors, medical students, residents, and fellows that I get to educate. They also inspire me to, you know, become better and be able to teach them in a more effective manner. My program that I do here at UConn Health is called IWIM, which is Inspiring Women in Engineering and Medicine. And this program was produced to really expose young girls and young females in high school about male-dominated fields such as orthopedics and engineering. I am very unique as a female orthopedic surgeon. Only about 7% of all orthopedic surgeons are women, so we're definitely a minority. And I think these programs and other STEM programs really expose showing powerful women and to younger generations of women that they can succeed as well. So the IWIM is a program which is a day-long program. They learn basically from other female surgeons, from medical students and residents. They get to perform mock procedures. They get to learn to suture. They do knee arthroscopy on really real live OR equipment with a fake knee model, and then also learn how to fix a bone that's broken with a plate and screws. So my advice for STEM students are, if you're interested in science and medicine and engineering and technology, that really go after it. Don't let anybody tell you no. If you have an interest in it, then you can definitely accomplish it.